Have you ever looked in the mirror and felt frustrated by uneven skin tone, dark spots, or patches of discoloration? You're not alone. Skin pigmentation issues are incredibly common, and they can affect our confidence and how we feel about ourselves. In this video, we're going to dive deep into understanding skin pigmentation, what causes it, the different types of disorders, and what you can do about it. So, let's get started. Before we get into the disorders, let's understand the science behind skin color. It's all about melanin, a pigment produced by specialized cells called melanocytes located in the outer layer of your skin. Melanocytes produce tiny structures called melanosomes, which contain melanin. The production of melanin, or melanogenesis, is a complex process involving an amino acid called tyrosine and an enzyme called tyrosinase. Melanin actually comes in two main forms: eumelanin, which is a brown-black pigment that is responsible for darker skin tones, and pheomelanin, which is a yellow-red pigment and is found in higher concentrations in those with lighter skin and especially in redheads. Now, what influences how much melanin we produce? Well, it's a mix of factors. Genetics play a major role in determining our baseline skin color. Sunlight, especially UV radiation, stimulates melanin production as a protective response. Hormones also play a big part, especially estrogen, progesterone, and melanocyte-stimulating hormone, MSH. Inflammation can trigger melanin production, and finally, our skin pigmentation can change with age. When we talk about pigmentation disorders, we can broadly categorize the factors that contribute to them. First, we have the causative factors. These are the direct triggers of the condition. Then there are risk factors, which increase the likelihood of developing the condition. And finally, we have predisposing factors, which make a person more susceptible to the condition. Understanding these categories can help us better grasp the complexities of pigmentation disorders. Now, let's move on to specific pigmentation disorders, starting with hyperpigmentation, which refers to areas of the skin that are darker than the surrounding skin. One common condition is melasma or chloasma, characterized by symmetrical patches of hyperpigmentation, usually on the face. This can be triggered by hormonal fluctuations such as pregnancy, oral contraceptives, and hormone replacement therapy, and is exacerbated by sun exposure. Risk factors for melasma include female gender, a family history, and darker skin types. Pregnancy is a major predisposing factor, hence the term mask of pregnancy. Another common issue is post-inflammatory hyperpigmentation, or PIH, which is the darkening of skin after an inflammatory condition such as acne, eczema, or injuries. Those with darker skin tones are at higher risk for PIH. Sun exposure and the severity of inflammation are also risk factors. Sun-induced hyperpigmentation, or solar lentigines, age spots, are caused by chronic UV radiation exposure, and those at risk are older individuals and those with prolonged sun exposure or fair skin. Other causes of hyperpigmentation include drug-induced hyperpigmentation from certain medications, acanthosis nigricans, a condition associated with insulin resistance, linea nigra seen during pregnancy, and, in rare cases, Addison's disease. Moving on to hyperpigmentation, which refers to areas of the skin that are lighter than the surrounding skin. One of the most well-known hyperpigmentation disorders is vitiligo, an autoimmune condition that causes white patches on the skin. This is due to the immune system attacking melanocytes. Risk factors include a family history and having other autoimmune diseases. Stress and skin trauma can be predisposing factors. In rare cases, inflammation can cause hypopigmentation rather than hyperpigmentation. Pityriasis alba, a common skin condition in children, presents with light patches and is often associated with mild eczema. Tinea versicolor, a fungal infection, can cause lighter or darker patches. And finally, albinism is a group of genetic conditions resulting in little or no melanin production, caused by mutations in genes involved in melanin production. It's important to note that not all changes in skin color are due to issues with melanin. There are other conditions that can cause discoloration. Cyanosis is a bluish discoloration caused by low oxygen levels in the blood due to conditions like respiratory or heart diseases. Erythema is redness of the skin caused by increased blood flow due to inflammation, sun exposure, or emotional responses. Jaundice is the yellowing of the skin and whites of the eyes caused by high levels of bilirubin in the blood due to conditions like liver disease or gallstones. And finally, purpura and petechiae are red or purple spots on skin due to bleeding under skin. Now, it's crucial to know when to seek medical advice. You should consult a dermatologist if you experience rapid changes in skin pigmentation, asymmetrical patches, or changes in the color, size, or shape of a mole or skin growth. You should also seek help if the discoloration is accompanied by itching, pain, or bleeding, if it occurs after starting a new medication, or if it's accompanied by general health symptoms like fatigue or weight loss. Skin pigmentation disorders are complex, and as you've seen, many factors can contribute to their development. Remember, this information is for education educational purposes and should not substitute professional medical advice. And here at Harley Street Medics, we understand how confusing skin issues can be, so we're offering a free online consultation with one of our expert dermatologists. This is the best opportunity to get personalized advice, discuss your unique skin concerns, and explore treatment options that are right for you. Click the link in the description below to book your free online consultation today. Thank you for watching, and don't forget to subscribe for more informative videos.